Hello, I'm Dr. Maynard, anesthesiologist at Good Samaritan Hospital. The purpose of this video is to explain the risks and benefits of anesthesia and to hopefully answer some of the questions you may have regarding your upcoming surgery. You will still meet with your anesthesia provider prior to your surgery to discuss any further questions you may have. While there are many types of anesthesia, the end goal is always the same, to make sure that you are safe and comfortable during your procedure. Sometimes this includes going all the way off to sleep, known as general anesthesia, or blocking pain to a portion of your body called regional anesthesia. Other times, sedation is used to keep you comfortable during a procedure. Regardless of the technique used, there are always some risks involved with anesthesia. These risks include, but are not limited to, injury to mouth, teeth, or eyes, lung, heart, or neurologic complications, and very rarely death. Many of these risks depend on your health and other risk factors such as the surgery itself, and these should be discussed with your anesthesia provider prior to your surgery. In general, though, anesthesia is very safe. In fact, it is safer than your drive to the hospital that morning. If you are to receive general anesthesia, this means being put all the way to sleep for your surgery. This involves placing a breathing tube to assist with your breathing. This is standard for all general anesthesia and is how we deliver oxygen, as well as the gas which keeps you asleep. This breathing tube is typically removed prior to waking up, and typically you do not recall it being in place. It can, however, cause a sore throat that may last a few days. During placement or removal of this breathing tube is when possible injury to the mouth, teeth, or lips may occur. During general anesthesia, it is expected that you are fully unaware of what is happening. Awareness during anesthesia is exceptionally rare. General anesthesia has the highest risk of nausea and vomiting after. If you have experienced postoperative nausea or vomiting in the past, please let your anesthesia provider know so that he or she may adjust their anesthetic accordingly. Regional anesthesia involves blocking pain to a portion of your body. This can be accomplished with a nerve block, spinal, or epidural. A nerve block may be placed intravenously or under the guidance of ultrasound. Depending on the procedure, you will likely also receive sedation both during the placement of the block as well as during the surgery itself. In other cases, regional anesthesia may be used in conjunction with general anesthesia to help with pain after the surgery. Risks with regional anesthesia include bleeding or infection at the needle insertion site, or injury to the surrounding nerves and blood vessels, which, in rare cases, could lead to paralysis. With spinal or epidural anesthesia, a post-dural puncture headache can occur. These complications are extremely rare, and typically the benefits far outweigh the risks. Monitored anesthesia care is commonly referred to as sedation. Sedation exists on a spectrum from simply being relaxed and fully aware to little to no recall of the procedure. The exact type of sedation depends on the procedure being performed and your health risk factors. The goal is to ensure you are as comfortable as possible during the procedure, and this doesn't necessarily mean being completely asleep. The primary risks associated with sedation are the need to assist with your breathing and the possibility of needing to convert to a general anesthetic.